guys, this is Dr. Hisham speaking again, and this video is mainly for my colleagues, the dentists. Also can be used, what I'm talking about here can be used by any medical practitioner in a clinic, in hospital, and of course you can take some tips out of this for your home use as well. The reason I'm doing this, other than the general ozone videos and experiments and redox reaction tests that I've done in the other videos last 2 weeks, this is very specific, very practical, very pragmatic. What to do in your clinic to manage oral biofilm, to manage aerosols, to manage this whole dilemma that we're going through now, and avoid being over-regulated and being scared into not even being able to practice or provide the services for the people who need it, because we're dealing with a lot more diseases in life than just one disease as we've been hammered into these days, without the extra costs and traumas and risks to you and to your practice and to your patients and to your staff. Now, most of what I'll be showing here, I've been doing for a long time, except for this new gadget here, which I spoke about before, but I'll talk about a bit more pragmatically today. We've been doing it for a long time, for years and years and years. So I will show you what we've been doing and how you can apply that into your own practice, starting tomorrow. Like I said, to manage aerosols, to manage the biofilm that's going inside the mouth. And if you are a healthcare practitioner or work in a hospital or a nurse or a doctor, and you're looking after people who are lying in bed for long periods of time or being intubated or whatever, this is exactly the same thing, because most of the pneumonias that happen in hospital are from oral biofilm, bad bacteria being breathed or pushed through with the intubation. And of course, while the person is intubated, nobody's cleaning their mouth, nobody's looking after what's happening in their mouth, provided they came in healthy in the first place, which most people will not come into hospital with healthy mouths. So for all these purposes, you should be able to do better looking after people's oral health while they're in hospital, of course, and beyond. That's a whole different discussion, not today's discussion. I'm just talking while they're under your care, in your dental chair or in your hospital bed. What can you do for them? As well as, like I said, for yourself, to keep yourself, your team and everybody safe with added benefits, not added risks. So what I'm going to show with ozone again, here, and with our oral care products and with the suction tubes and all these things, is not just to manage aerosol or viruses, is to manage everything that's going inside the mouth, to manage all your risks and the patient risks while they're under your care, as well as, like I said again, your staff, your team, everybody around you. So one of the first things I brought, this is our old ozone machine, water ozonator from the clinic. Actually, sorry, this one was in the clinic, then went to the factory, then we had it in service. I showed in the other videos the newer one. This is about 11 years old. The other one is 5 or 6 years old now, and we have one in the factory, one in the clinic, and in between we have other ozone machines anyway. So this one here is exactly the same as the white one, that obviously nicer, newer model that one was, which is basically plugged into a filter that brings in filtered water into the back of it. Sensor, you wash your hands with that. So now you're washing with soap, of course, and scrubbing and doing all the correct stuff, but the water that's ozonated is disinfecting everything on contact. Viruses, bacteria, fungi, everything that's bad, it oxidizes it. At 4 ppm, 4 parts per million, it's proven already. Look up the science. I've shared it many times before and I'll share it again. Not my science, it's just science. Viruses die on contact, especially the ones that have a capsid, like HIV virus, the Ebola virus, the obviously all the SARS, MERS, the COVID is just SARS-2 and all these things. So you're killing all of these on contact without any residue. Yes, there are other ways to do this, but all of them include risks to you, risks to your hand, risks to your microbiome, risks to the environment. What about just ozone that breaks down to water and oxygen? Easy, cheap. Once this is installed, once you bought them installed, and they've become a lot cheaper, I'll show you the other taps in a second here. They become cheaper, better looking, better functioning, and everything else. What's the problem with that? It costs you nothing once it's installed. It's just the water that's coming in anyway, and a bit of power. Filter change once a year, maybe service it once every 5 years or whatever. Easy stuff basically, but doesn't cost you any money. Because things like peroxide, which you can use to wash your hands with or rinse the mouth with, including our own mouth rinse, which is a very strong oxidizing agent that's safe to ingest, still expensive. This is expensive, as well as this doesn't have any side effects at all. However, it's still the expense to give it to every patient to rinse with or rub your hands with it all the time, that's ridiculous. This is for home use. You take it, you use it every day because it is food grade. Peroxide, expense is one thing. I love peroxide, by the way. I'm not saying peroxide is bad. I'm just saying use it with care, because as I showed in the other videos, it is acidic. It reacts very quickly with organic matter and extremely rapidly with blood. So at 2 to 3%, excellent for flushing inside the gum line when you have gum disease, basically when we're treating gum disease as part of the protocol with lasers and iodine and peroxide, not at the same time iodine and peroxide, as you remember from the last video. Excellent for that, because it does peel that inner inflamed epithelium, bubbles out, releases oxygen, very good. That reaction is fantastic when controlled. But to put it in the mouth and just rinse with it at 2, 3, or 5, or 6%, as some of these come, that's ridiculous. That's a very strong mucosal irritant. At 0.5% or 1%, it's not that dangerous at all. Yes, you can use that as a rinse, but now the cost becomes one thing, and there's still that micro irritability that's happening. Why don't you just use ozone? So ozone for rinsing at 4 ppm, the same water. You put it in a cup, every patient rinses with it, that mucosa and everything that it touches, basically, you rinse with it for a minute or twice for 30 seconds each, basically, so it's nice and fresh. It's clean. Now you can go on and clean their mouths, treat their mouths. The aerosol that's coming out is clean technically. However, I'll still show you ways to manage the aerosol so it doesn't come out as much in the first place, because we're all at risk of this all the time. We've always been and always will be. Not COVID, nothing new to us, nothing strange here. Who wants HIV on their face, or hepatitis, or forget about the viruses, just the bacteria that are there all the bloody time, the stuff that we're cleaning out. Who wants that on their face all the time? And yet what? We don't treat people? We don't take care? No, we take care of ourselves and them. Proper masks, fine. We'll talk about the N95 masks now underneath your other mask, so it protects the mask from dirt and blood and stuff getting onto it, and the mask itself can be sterilized and disinfected in this ozone machine. Much better, much safer, much easier to make at home or in the clinic, basically, than UV lights. So back to peroxide. Like I said, for flushing in a controlled way, us as the providers, we can use it very carefully and properly, no problem at all. I love that. But to use it willy-nilly all the time, not a good idea for mucosa, and then there's the cost as well. Ozone water gets made on the time. Only thing you have to invest in is the machines. So this is our old machine. We have a newer one I showed in the other videos. White, nicer, same manufacturer. And now we have these brand new ones, which we'll put across the clinic and at home as well, which are, like I said, cheaper than those ones and much better looking. So this is all you see. It's a tap, basically. It's called the Kona tap. This is what sits on top of the bench, also with the sensor. So you just put your hands in front of the sensor, water with ozone turns on, sensor again turns off. And the machine, so it's not as big as this, because the machine that makes the ozone and the power and everything else is under the bench. So that's all. This goes under the bench, nothing is above, and this is underneath. I would still advise you to have it attached to a filter, so there's no fluoride and no chlorine going into that tap, because the chlorine and the fluoride can interact with the ozone and inactivate it as well, and it's messy. So filter the water, just standard filters. We have three filters before every ozone machine in the factory where we make the products, and in the clinic as well. So we'll have the same for these. Triple filters, clean water going in, gets ozonated. Wash your hands, wash your face, wash your glasses, wash your protective gear, rinse with it yourself, drink some of it every now and then, rinse with it for every patient when they come in during treatment. Yes, you can use it as a flush if you choose to as well. It doesn't have that reactive bubbling effect like peroxide, which is good in a way, but if you're doing gum disease treatment and you want to bubble out that debris, that's where the peroxide comes in very handy. Home use, not everybody would have machines like this at home, and it's not enough just to oxidize. We need other stuff as well. Use oxidizing agents mixed with what I've got here, the xylitol, the biominerals, and all that other stuff. This is a different subject altogether. With the ozone machines for ozonating the water taps, I will talk about this box to disinfect equipment right now in a second. I'm also working, as I've said in my other videos, and the tests are gonna go through next week, on this invisible glove, which is antiviral, antibacterial, yet nourishing and nurturing for skin. Rather than being an alcohol rub, it actually absorbs, stays on, full of mainly organic oils, carrying tauterol and neem and other stuff as well. So when you rub with it, it actually heals and nurtures. It's very moisturizing, but it stays on. It's also got beeswax in it, so it stays on like an invisible glove. Because we see a lot of people, this is not relating to us, to practitioners, because we know how to use gloves. Unfortunately, we use too many of them, but that's the nature of the beast. That's what it is. But we know how to put them on. We know how to take them off. We don't touch everything with our gloves while we've got them on. We have them in the mouth. Things get handed to us. We have to move. I have to touch myself or whatever. Got to take the gloves off properly, which most people don't know how to do, and yet everybody's trying to wear gloves these days, just passing on the dirt, holding everything with it. It's counterproductive, and of course very environmentally unfriendly. Or a lot of alcohol sanitizers, a little bit of that is okay, but every day for a long time, that will destroy your skin and your microbiome. We want something that will nurture and stay on, not just active at moment of use, that will stay on and nurture, like I said at the beginning, extra benefits. What are the value-added benefits rather than what are the risks? There's no risk with this. It stays on your hands, actively fighting viruses, bad bacteria and everything else, while nurturing and healing your own skin. You will love this, but the results of the actual viral activity tests, the antiviral activity tests, will come out next week or the week after because of the closed down lockdowns. So, managing biofilm inside the mouth, again, iodine, I spoke about it in the other videos and in all my courses, peroxide, ozone, iodine, and lasers. When we're doing a scaling, a cleaning, or anything bigger than just a simple check, basically, always iodine prophy. So get them to rinse with all this, but know that rinsing, whether it's peroxide or ozone or my own mouth rinse, will not penetrate deep through biofilm. So if there's thick biofilm, it won't penetrate deep through it. It's good for the mucosa, it's good for the gingiva on the outside, it's good for the surface of the teeth, but it won't go through the dirt. So once you start scaling and there's plaque and tartar and dirt basically stuck on there, you won't be able to make any of these liquids penetrate through it, even with rinsing. So you've got to scrub those off, and without creating a plume or creating aerosol, scrub it off while disinfecting. And the best thing to do that with is iodine mixed with prophylaxis paste. So you're polishing that without water, without spray, you're polishing that off, you're scrubbing the dirt off, you're scrubbing the biofilm and the pellicle on the teeth and on the gums away while applying the iodine, just like they scrub you in hospital before any surgery. Scrub that on, removes the big dirt, makes everything cleaner, makes it whiter as well, because iodine is also an oxidizing agent, so teeth do look whiter, which is nice. Before you actually scale, drill, fill, laser, whatever you're going to do that would create the plumes. Now, to manage the plumes or the aerosols, I've been using this since 2003. I used to buy it in the US. Every year when I went there, I used to buy a huge bulk of it until it became available in Australia and New Zealand through Henry Schein. I do not make this nor sell this. By the way, I don't sell any of these. These are my products. Yes, I make them. I don't make peroxide. I buy it. These are not mine. I'll let you know where to get them if you want to know. This is patented by Isolite. It's not mine. I've been using it, like I said, for 17 years now. Now they're available in Australia and New Zealand. The Isolite is fantastic because it's not just isolation and protection for the patient from swallowing any debris or mercury or toxins or rubbish or whatever, but also it's an opener, and it cups around and suctions everything in. So as you're working, and we've done this during my courses, I've shown it to you. If you have been to one of my courses, you've seen this. We spray water like direct from the triplex syringe, active water spray. Nothing comes out. It just goes, all gets suctioned out. The only problem that I found over the many years of using Isolite was the actual attachment system that attaches to this with the tubes to the suction. It's very cumbersome, needs extra attachments, very easy to break and damage when you autoclave it and you have to clean it, and very expensive. It's about $2,000 and you need at least 2 per room to keep changing them, and if you have multiple rooms, that adds up, and then they do break and then you got to replace them and so on and so forth. So over the years I went and made an adapter that looks like this, which is unbreakable, literally. This is anodized aluminium. I had it 3D designed and milled, and then a colleague of mine, Ted, hand lased them basically after that design was made out of plastic, and we anodized them. We can send you, if you want to ask us, just ask me about these. Unbreakable, like I said, very easy to clean because the holes are very big, which means also more suction going through. They fit to any standard suction adapter, and then they fit into here. So this is not patented or anything like that. This is the part that's patented by Isolite. This is just an adapter, a suction adapter for the Isolite. Goes in there. suction out, it will work on top, work on top, work on the bottom, or the other side. Suction here. So it protects you from the aerosol coming out in the first place. Now, do disinfect them out, absolutely. Some will come out, but manage how much comes out by this. Rubber dam, I love rubber dam. Well, used to love it a lot, but haven't used it for years now because, other than for root canals, which I don't do much anyway of, because with rubber dam, yes, you're protecting the patient, but also whatever you're spraying, whatever you're doing, gets to bounce off the rubber dam. So there's more aerosol coming out towards us from the rubber dam. With this, there's more protection. I have access to upper and lower at the same time. It's a bi-block at the same time as well. And it suctions everything in from all around. It cups like this and suctions all around right there. I'll post a photo of this so you can see it clearer. I've also posted it before on multiple of our groups, and during my courses I will show it in use. Now, this box here, now it looks like we will be having to use at least the N95 masks as well as full body gear all the time from now on, which I'm not against completely, but I'm against going with full body hooded shield and all these things that you can't even breathe in. That's crazy and ridiculous and is not needed. However, the N95 masks, fine, we'll use them from now on. They are very expensive and getting more and more expensive, so I would say use a normal mask, the cheaper one, over it. That one will catch any blood splatter or anything like that because you can throw it out. The N95 masks, you can reuse them. If there's no blood on them, just disinfect them first. As well as any other gear that you can't wash but hasn't been soiled with blood, you can easily disinfect that if you can't put it in the autoclave, and we cannot put these things in the autoclave. And you've heard about people in hospitals now, in New Zealand, in New York, in multiple parts of the world, finding ways to disinfect them. And I'm sure there's many great ways. UV light is good, but it's dangerous for the eyes. It's expensive to insulate and all that. So we made this with Ted, my colleague again. We made this airtight or semi-airtight Perspex box. It has to be hard Perspex or glass. It can't be soft plastic, otherwise the ozone will break it down. You put your N95 mask or anything that's, like I said, not soiled, but potentially contaminated with some aerosols that you want to reuse. You plug the inlet into an ozone generator, like this one here. So that's an ozone generator. You plug that in. The ozone generator is ideally connected to an oxygen concentrator. Now, why an oxygen concentrator? Because the more pure the oxygen that goes in, the more pure and stronger the ozone that comes out. Normal air has only 20% oxygen, so only that can be used to make ozone. The rest is nitrogen, obviously 80%, and the rest is little carbon dioxide or whatever other gases. So you will not get a lot of ozone in to decontaminate if that's what your use is. And if you use oxygen tanks, which are fantastic if you're going to use medical ozone, which is pure ozone, 100% oxygen going in, 100% ozone coming out, of course, and some oxygen. It's oxygen and ozone coming out. That can be injected in all these. That's a whole different story, but also expensive. You can't be using oxygen tanks all the time just to disinfect stuff. These are much cheaper once you buy them. Oxygen concentrators, they just work for years and years and years. Again, change the filter once every few years or whatever, however you use it. It makes 95 to 96% pure oxygen out of thin air, basically. So it concentrates the oxygen out of the air, pushes that through into the ozone manufacturer, the ozone maker, ozone into this box, and ozone is heavier than air. If you're gonna make this, it's just a standard Perspex box basically. If you're gonna make this, make sure the ozone goes down here, down at the bottom, because ozone is heavier than air. So it will start to accumulate from the bottom up. It won't go up like this. It will displace the air by filling in from the bottom up. The air that comes out and the excess ozone, as this is working obviously, has to be broken down, because that's the only risk of ozone, is breathing too much pure ozone in. Lung irritant. And you will know it. After a minute or two, you'll go, it's not something that you want to go through all the time. So that's the ozone in water, totally safe. Ozone in a container is totally fine. Ozone injected into fluids, totally fine, totally safe and totally great. However, ozone gas, don't breathe it in for too long. So you have to have an ozone breaker, an ozone destructor, basically, different names for it, that will attach to some point here. So we have a hole through there. This sits on top, and whatever air comes out of this the ozone gets deconstructed. Now, ozone also breaks down with UV. That's why the ozone layer protects us from ultraviolet light. And we destroyed a lot of that ozone layer, and we had our own problems with that. And now, since we stopped using the HFCs, hydrofluorocarbons, fluoride gases that destroyed the ozone, it's healing, which is good. However, the point I'm trying to make here is ultraviolet light will also break it down. So what comes out gets deconstructed here, and it's just, again, pure oxygen. What stays inside, once this has been on for 10-15 minutes to disinfect what's inside, and it's dry, obviously, don't use sprays. And I've heard people using aerosolized peroxide, hydrogen peroxide. Other than the expense, that's crazy, because peroxide is a liquid. You aerosolize it, it gets stuck onto the materials. Now you're putting those wet materials, or even if they look dry, there's still peroxide on them. You put them on your face, it starts to react with your skin. Not a good idea at all. Aerosolized peroxide, not a good idea. Never inject it into the body as well, as we spoke in the other videos. So it's a gas, it's a dry gas, decontaminates everything on contact. Once it's around normal air and ultraviolet light just from normal lamps, basically, for 10-20 minutes, maybe 30 minutes, whatever, depending on the concentration, it will all break down again. So don't expect to leave this box for 10 minutes without any ozone coming in and then still find ozone, and it will all break down. So whatever is actively coming out, being pushed out, gets broken down here. Whatever stays in here, turn everything off, leave it for half an hour or so, and then open it. There might be a residual smell of ozone, but there's no big ozone gas in there. It's all broken down to oxygen again as well, which means no residue of any kind that is harmful to you or to your skin or anything like that on these masks, on any other items. So I hope this was useful. Ozone taps, fantastic. Please have those for washing items, hands, faces, rinsing with it yourself, your team, and for every patient before any procedure. Multiple different types. If you can afford it, have an ozone, it's called a central disinfection unit, a CDU, an ozone disinfection unit, as we also have in the practice, that's plumbed into the mains plumbing coming into the whole practice, which means all the water taps, all the chairs, any water coming through is ozonated. Now, of course, no matter how much ozone that machine makes, it will always be weaker at the end point because it's used up in the tubes and killing the biofilm, which is fantastic for that, so we don't introduce more biofilm into people's mouths and bodies. Great idea. So don't expect that when it comes out of the tap to be strong enough to be the actual rinse. However, that water is clean, that water line is clean, and yes, there will maybe be one or 2 ppm in there, which is totally fine. But to make an active rinse, you have to make it at the time. It's going to be made at the time. You can't sell ozone in bottles. It breaks down, like I said before. So to oxygen, nothing bad. But it's not functional anymore. So it's got to be made fresh. Just fill up the tap, sensor, fill up the tap, give them a rinse, 30 seconds, repeat for 30 seconds. Mouth is as clean as possible, except, like I said, thick biofilm, which has to be scrubbed off. That's a different story. Ozone taps, ozone generators with an ozone chamber, basically, in the clinic. If you want to disinfect stuff to reuse it, that is not soiled with blood and dirt, that has to be thrown away or washed if you can wash it. Anyway, neither of these things can be washed. And then for home use, yes, oxidizing agents like armathrins, which are food grade, can be ingested in small amounts. That's totally fine, but will not react aggressively or cause any dramas to mucosa or the mouth. Peroxide, if somebody wants to use it, absolutely fine. Like I said before, be careful, watch the concentrations, understand the use, understand the interactions, keep it safe, add value, add safety, add benefit all the time, never cause harm. Thank you. Until I see you next time, have a great day.